I got a note from a student that I had worked with over the past year. When I met her, she clearly wasn't going to pass her national exams. And when I explored how she learned, she just had atrocious learning habits. They were undisciplined, they were based on conversations. If I'd asked to say, show me your notes, she would have had none to show me. And so she was this cheerful, delightful person, and she just put up with the beatings that you get when you work with me because I'm not going to pretend you know when you don't. Well, she did that, and she came with a group, and really fun to work with. They really worked hard. They took their beatings like true adults. And I just got a note from her that she passed. So I sent that note to someone in the higher administration because I wanted them to see that when you come and do this pathophysiology, even people who have very little knowledge can organize surprisingly rapidly with surprisingly few interactions so that they can actually pass national exams. And the response I got from administration was, well, she barely passed. The problem with just squeaking by, if 70 is the past and you squeak through with a 73, the problem is you're extremely vulnerable going into the future because it means you don't know enough. It means that now is your chance. You didn't pass. You dodged a bullet. You have to understand that. 70 plus 70 plus 70 equals fail. When I got the note, she barely passed, I sent the note back to administration. Well, she's really vulnerable. Do we have any way in the system to let her know that? How are we going to help her going forward? Because what's happening by passing her, basically her step one exam, she's now going into clerkship without enough knowledge and not having the patterns of learning. Because now she's going forward to see her patients and she has to flip how she's learning. She's not sitting at a desk with time every day. She's got to learn from every patient. Presentation, pathophys, natural history. And so it goes to this discussion, what are the first 2 years for? The first 2 years are so that you shouldn't have to have anything explained when you meet patient care. You should be so comfortable with chief complaint to differential diagnosis based on pathophys criteria that it all makes sense to you. You're just going to your clinical clerk year to learn how to do something. But if you're going in with a 70, you don't have enough basic sciences. You haven't learned this connection that clinical medicine's built on a foundation of basic medical sciences. And so when I asked my school, how do we plan to do that? They didn't have a satisfactory answer to me. And I got to tell you, I haven't met a medical school yet where that is true. So now I'm left with this young woman. I have a relationship with her. I like her very much. And she's vulnerable. So what do I do now? How does she learn how to learn? And how does she patch her deficiencies going into patient care? I'm going to think about that all day.